The area that I've been focusing on is the consultation on local democratic legitimacy. The main areas that that consultation focuses on are around increasing the role that local authorities will play in health improvement. In particular, they see that formal public health functions will be moving to local authorities. Secondly, each local authority will host a health and wellbeing board that will have three fundamental roles. Firstly, assessing local health population needs. Secondly, coordinating and overseeing commissioning plans across health and social care. And then thirdly, scrutinising healthcare plans across the sector as well. We really welcome the idea that local authorities will play a greater role in healthcare decision making and delivery, particularly around wider determinants of health and ensuring that there's provision that thinks about housing, transport, leisure activities and other functions that local authorities have traditionally been involved in. However, we're unsure what the role of health and wellbeing boards will be in relation to the NHS Commissioning Board and whether GP consortia will be held to account by two very different organisations and that may represent some conflict for them. The advice that we'd give to government is to really reflect on the accountability arrangements that GP consortia will have to the NHS Commissioning Board as well as to local health and wellbeing boards, and making sure that those lines of accountability are seamless and not in conflict in any way. The government's white paper mentions a greater role for employee-owned organisations in the NHS. We'd welcome a greater diversity of provider models in this way and see that employee-owned organisations can promote greater staff engagement, leadership in decision-making, where all of those working in an NHS organisation can really play a role in the operation of the activities they do. The reforms in this consultation document will give more power to local communities who will have a greater role in decision-making around public health and wider determinants of health, as well as specifically to local authorities who are going to have a greater role in the way that decisions are made by GP consortia and a greater role in the operation of the NHS.